Guys, you're going through the video lessons, you're reading the books, and you're understanding certain basics, but you still don't have the confidence to deal with patient reports. Your relatives keep sending WhatsApp texts of their reports, and you're not able to interpret, you're not able to give them an opinion. Of course, I know you are a medical student and you are not supposed to give medical opinions right now, but your relatives are expecting, and you also want to be confident in analyzing the reports. Well, one approach is to understand the subject very well so that you can interpret all the reports. But if you're struggling, what's the solution? If you can reach out to a teacher and he has time enough to simplify things for you, well and good. But then in today's fast paced world, not all the teachers have enough time to dedicate to individual students' issues. So, can we have a Gen Z modern solution for this problem? Well, this is the era of artificial intelligence, and AI tools are there to solve the problems. So, today we will learn how to use AI tools like Gemini to interpret the reports. And also, while the AI interprets the reports, how do we get to learn to interpret the reports from it? Let's do an experiment. I have an ABG report which is already loaded to Gemini. Gemini is my go-to AI tool, and I will share this ABG report to the Gemini. I know how to interpret the ABG, but I'm trying to make it easy for you. And I will give a command to the Gemini to interpret this ABG. Every time you want to ask the Gemini to interpret any of the reports, you can tell the Gemini to give you the diagnosis, but at the same time also ask it in the command how it arrived at the diagnosis. Then it will give you the stepwise breakdown. How did it rule out something, or how did it rule in something, and you will arrive at the final diagnosis by going through the stepwise analysis. And you can later analyze the stepwise analysis, and then whether your understanding of steps involved in ABG interpretation, steps involved in the LFT interpretation, whether you're right or wrong, you can decide as well. Okay, so let's see how Gemini interprets. Hey Gemini, I am sharing an ABG report with you. I want you to analyze the report and tell me what is the diagnosis, but at the same time I also want you to give me the stepwise breakdown of how you arrived at the diagnosis. So let's see how does it interpret. So Gemini says the report contains some significantly abnormal values. It has already made the primary diagnosis as the metabolic acidosis, that is severe and is partially compensated. This was what my diagnosis was. So it is agreeing with our assumption. Then it is mentioning the patient values, normal range, and whether those parameters are altered or they are within the normal range. And then it is clearly giving you a stepwise breakdown. So it has analyzed the pH first to decide acidosis or alkalosis. Then it has analyzed the respiratory component. Then it has analyzed what is the primary disorder, whether primary was metabolic or respiratory. Then it has also assessed the compensation, whether compensation was appropriate or not. And then it has eventually reviewed all other details embedded in the ABG to give you the final diagnosis. So this is exactly what we teach you in the classes, the stepwise analysis. But if you're not able to follow through, then you can also take the help of AI tools like Gemini to make things easier for you. You can follow the same template for any report. Like if I have an LFT report and I'm not able to interpret, I can give it to the Gemini and ask it to interpret. It will definitely give you the diagnosis, which even patients and their relatives do it. But you can ask the Gemini to give you a stepwise breakdown of how it arrived at that conclusion, and it will clearly tell you why did it consider it as inherited hyperbilirubinemia, or why did it consider it as possible fatty liver disease. So if you have all the reports available, you can stack up and ask the Gemini to give you a stepwise breakdown. So this is how you can start preparing smartly and become a better doctor. Now, shall we try if the same template can work for LFT report as well? Let's see. Hey Gemini, I have an LFT report. I will be sharing that with you. I want you to tell me the diagnosis, but at the same time, I also want you to tell me the stepwise breakdown on how you arrived at that diagnosis. So let's see if it interprets and gives us the appropriate diagnosis. Well, Gemini has already analyzed and given me the output. Let's see what it has done. So it has given me the primary clinical impression as alcohol related liver disease, suggest that to chronic liver disease, possibly suggestive of ALD. And then it has given me the breakdown, the patient observed parameters, reference range, and whether the parameters are normal or high or low. And then as I scroll through, it has given me the stepwise breakdown. First, it has looked at the bilirubin, then it has looked at the liver synthetic function, that is albumin levels. Then it has looked at the hepatocellular injury parameter, whether the AST, ALT were elevated or not. Then it has looked at the biliary tree function, whether ALP and GGT are altered or not, and that is how it has arrived at the conclusion. And this is exactly what we teach you in the classes, the stepwise breakdown. You can definitely listen to the classes, but practicing the interpretation of report along with the AI tools makes you better and smarter. On one side, you will learn how to use the AI tools. At the same time, parallelly, you will also learn how the stepwise analysis is done. So both in your MCQ and clinical practice, as well as being quicker and smarter in clinical practice, every way the use of AI tool helps you.